Map Chats.
Hello, everyone, and thanks again so much for joining us for the Public Health Insights webinar today. My name is Kristin Crandall, and I'm a data analyst here with PolicyMap. And again, I just want to reiterate, please do write in as many questions as you have. I would love to answer all of them. So just a quick introduction to PolicyMap. This is a mapping platform developed by the Reinvestment Fund, which is a community development financial institution located in Philadelphia. So historically, we built a tool to be used for community development purposes. So we had a lot of data related to demographics and housing and those types of subjects. And in the last few years, we've had a strongly growing much more requests for health-related data. So we've been adding a lot of that. And so today I'm going to cover how you would use PolicyMap for a number of uses related to public health. So the agenda for today's webinar is as follows. First, I'll show you how to use our maps, because that is what is most commonly used on PolicyMap. And I'll show you some of the health-related data that we have available for our users. And then depending on time, I'll be showing you some of the more advanced functions that can be used for some really compelling health-related analysis, as well as an example of how your local health data can be used on our platform as well. And for those who don't get enough information today, I just want to let you know that we do have ongoing trainings, so you can find those at policymap.com. So everyone now should be able to see the map here of the United States. So this is our maps page. And the way that you would generally begin is by looking for a location that you're interested in. So we have users all over the country. And so you can type in, I'll type in a city, say Providence, Rhode Island. And you'll see that the map zooms to that location. You can also use this set location bar to go to another. If there's a certain tract that you would like to zoom to, you can do that, or a certain congressional district, school district, metro area, etc. You can also type in a zip code here, which a lot of our users do, and the map will go to that zip code. In terms of moving the map, we try to, in interacting with the map, we try to make it pretty much as easy to use it as Google Maps. So it should be pretty intuitive. You just pan. You can pan the map like this. You zoom in and out using the zoom bar on the side. You can also double-click on the map to zoom in. And that's basically how the map works. In terms of the data, we have all of the data located right above the map. You can see it says demographics, incomes and spending, housing, lending, etc. Here's our health tab. And within each of these tabs, there's quite a wealth of data related to that subject. So if I click on demographics, you'll see a pretty long list of data we have related to demographics. And most of these items also have submenus that go out and provide more detail. So you see there's total population, population density, race as an example. This is of an indicator that where there's a submenu providing you more detailed information about different racial groups. So, for example, if I select African American, you'll see that this data is then loaded to the map, and now we're seeing the percent of the population that is African American on the map. And so the areas that are darker purple have a higher concentration of African American residents. And up here above the map, you'll see the title. This is where you go to read exactly what it is that you're looking at. If you click on this, this is how you'll get more information about exactly which data it is that you're looking at. This will always provide the source, exactly where we got the data from, anything that we think that our users need to know about what we've done to the data before putting it on PolicyMap. So this is a really good place to come to get more information about, to help you understand exactly what it is you're looking at and how you would use it. Here at the end of this description, it says See Data Directory. So you could always click here. This will take you to an even more extensive explanation of all of the sources for all of the data that we have in our platform. I want to show you the legend now, which is where you'll find be able to interact a little bit more with whatever data it is that you're looking at. So you can see the legend is movable, so you can move that around by dragging it. And we've made the legend interactive, so there's actually quite a bit that you can do with it in terms of changing what it is that you're looking at. You'll see here it says year. If I click on the year, 2012, you'll see that any other years for which this data is available will show up in this menu. So right now I'm looking at the Census American Community Survey 2008-2012 data, but I could also select 2010 and see the decennial census African American figures. Or similarly, if I wanted more historical data, I could select 2000. There's also a variable selection you can make here. The default for this is that you're looking at the percent of the population that's African American, but oftentimes you might want to know the exact number of African Americans who are in an area, or you might want to see the percent change over time. This is one of the something very valuable that we do at PolicyMap is we try to calculate a percent change for data whenever possible so that users can access that. And on the map, whenever you have the data shading the map, if you click on an area, you'll see that you're able to get the value, the specific value for whatever location it is that you're looking at. So you see where I just clicked on the map, it's showing me that in this census tract, 35.47% of the population is African American. So anytime that you want to get the exact value for a certain area, you just need to click on the map and you'll be able to see that number. We try to provide all the data at a number of different geographies, and we try to provide it at as low a geography as possible so that our users can get as nuanced an understanding of a place as possible. But it really depends on the source of that data. So for all of our census data, that tends to be available at very low geographies, so down to the block group or tract level. And then with some of the health data, as we'll get to in a little bit, some of that is only available at the county level or higher. But we do make every effort to provide the data at the lowest geographies possible. And if in the legend, where it says shaded by, you see that you can see the different options for that particular data set for how the map will be shaded. So if I want to see the map shaded by county, I can select county, and now the map is being shaded at the county level. In the legend, the last few things I want to show you is here. There is an option to change the colors. We've provided a number of different color ramps, which is very exciting. So you can just apply whichever one is most interesting to you. And then also we've made it so that you can adjust the ranges so that you can see the map shaded in whatever way is most compelling based on the area that you're looking at. So there is actually quite a bit of interaction and stuff that you can do with the legend here. So that's the basics of how the map kind of works. So now I'm going to show you just an overview of some of the data that we have within PolicyMap. I don't have time to get into the detail about all of it, but I'll show you some of the highlights of what some of our users that work in public health, some of the data that they most frequently use. So within demographics, you'll see some data related to social determinants of health. You'll see we have this new data about diversity, including this data showing you the predominant racial or ethnic group in an area. So I'll zoom back into Providence here. Oh, just 1 second. So now we're looking at Providence, and you see in the legend that any tract that is a shade of green has the white racial group as the predominant racial group in that area. And a lighter shade of green means that there's a lower white population, but they're still predominant. And a darker shade of green means that there's a higher percentage of the population that's white, but they are predominant. And you'll see that the shades of orange here, the legend is showing you that these are all areas where the Hispanic population is the predominant ethnicity in the area. So if I zoom in, this is just a quick one data layer that our users find very helpful to be able to get an overview of kind of the racial and ethnic makeup of an area, which obviously can be quite helpful when you're working in public health. So you can see some other data layers and demographics that may be of interest. People with disabilities, there's quite a few subcategories within that that our users find very useful. There's also from the census the percent of the population that's foreign-born, and also percent of the population that's non-English speaking or Spanish speaking. This can also be quite useful in getting a sense of the landscape and as it relates to health. So you can see some of the other data related to demographics. We'll move on over here to incomes and spending. We do have quite a number of data layers related to income and poverty. People in poverty, families in poverty, all obviously very important when considering social determinants of health. You can look at per capita income, family income. You could look at single-family headed families with children and the median family income for those families. Various subcategories for people in poverty, families in poverty. Also within incomes and spending, I would just draw your attention to, we do have some data related to food stamps. You can see the percent of the population that is receiving food stamps, and the percent of families and the percent of working families that are receiving food stamps. This data is quite popular amongst our users. We also have some fairly new data related to food insecurity, as well as child food insecurity. This is at the county level, so I would definitely encourage you to take a look at that at your convenience as well. And I just want to remind everyone that as I'm going through these data tabs, if you do have any specific questions about data that you see or data that you're wondering about whether we have, please do type it in so that I'm able to answer that. I know we do have a huge wealth of data within here, and some of it you just need to explore on your own, but I would definitely love to answer any questions about data that you would like for me to talk about during the webinar. So we also have a lot of data related to housing. I won't spend too much time on this, but it's definitely of interest to some of our users who work in public health, but I won't spend too much time on it, but you'll see there is data that I'll point out related to vacancy, both commercial vacancy and residential vacancy, which could be of interest to you if you're doing a community health needs assessment. We also have information related to homeowner and renter cost burdens. So you're able to see what percentage of the population, say around your hospital or in a certain area, which percent of those homeowners or those renters are spending more than 30% of their income on their housing. This can have a lot of policy implications, some of which definitely relate to public health. There is one question about whether we have data on violence. We do get that question quite frequently about crime. This question is coming from Gina Brooks. And unfortunately at this time we don't have, because this is a national platform, we don't have a lot of local data. What we do have for crime is located here in the quality of life tab. At the very top, this data is only provided down to either at the county or the city level, so it doesn't go down to the neighborhood level, unfortunately. But this is from the FBI. It is really great data. You'll see there are violent and nonviolent crimes here. But we also do, for many of our users, we do load local crime data as well. So if you have a subscription with us, then my data team we're more than happy to load local crime data for you. And that's actually something that we do quite frequently. And it's a really great use of PolicyMap. So I also want to point out here in the Quality of Life tab, while we're here, down here it says commute to work. We do have some census data related to that will show you whether households that don't have any vehicles, as well as the average number of vehicles, as this can be helpful in trying to understand, when thinking about how patients would be getting to a health center, whether they'd be taking public transportation, whether they'd be driving. Also, when thinking about a number of other policy issues as well. And here is a mode of transportation, so you could get a quick picture of what percentage of people in an area are using public transportation versus using a bicycle versus walking to work. Now I just want to show you really quick the economy tab. The main items here I'd like to point out is unemployment, obviously very important when thinking about the social determinants of health. We have annual and monthly unemployment data from the BLS. And we also have unemployment data from the census. And the last thing here I would show you is that we do have some really interesting data down to a very, very low geography, the block group, which is through the census, and it gives you a quick picture of the employment, where people are working and where they're living for people who are work in healthcare and social assistance. So that could be of interest as well. And so I'm seeing a question from Claudia Davidson, which asks, do you have data on homeless populations and services like healthcare for the homeless grantees? Unfortunately, there isn't any really great homelessness data at the national level that we've been able to acquire. We're always open and looking for other data sources, so if you do know of anything, we would definitely love to hear about it. But given the challenges of tracking the homeless population and having up-to-date data on that, there unfortunately at this point doesn't seem to be a national data source that we have been able to load. We do just have in demographics, you'll see at the bottom here of the list, it says homelessness. Unfortunately, this data is at the state level, so it's not going to be probably quite as useful as perhaps what you're looking for, which would be, homelessness at the city level at least, or, even if possible at a neighborhood level. So, but we do have this data related to the homeless population at the state level, and this is from the Department of Housing and Urban Development. So now I just want to jump into the health tab, which is probably where most people are most interested in learning about. And you'll see it's pretty full. We do have quite a bit of data related to health. We start here with physical health, a number of indicators related to obesity, adult obesity, as well as child low-income obesity, as well as various types of illnesses and diseases. Cancer, we have a number of different breakdowns in different types of cancer. Diabetes, which is very commonly used, data related to physical inactivity. We've recently been growing the amount of data we have related to infectious diseases. You can see here a quick overview of what we do have. We also have data related to mortality. And so most of this data here is from the CDC, as you might imagine. It tends to be only provided down to the county level. We will, over the course of the next few months, be releasing some indicators related to obesity and disease and health patterns that will be down to the census tract level, and that's from the Behavior Risk Factor Surveillance System. data. And so that will be really exciting, and once we've released that, we'll definitely be letting our users know. But that will be some really exciting health data that will be available down to the neighborhood level, so the census tract level. And so we have also have data here related to infant and maternal health, showing low birth weight, very low birth weight, as well as infant deaths and prenatal care. And we have a question here from Andrea Ambar, which is there any data for the older population, health clinics, senior centers, et cetera? And yes, we definitely have data that's specific to the older populations, and we also do have health clinic data. So let me show you some of that. A number of our data sets provide age breakdown. So here you'll see it says healthcare insured and uninsured populations. So this is some data that we added from the Census American Community Survey last year. And you'll see if you select over by age that you're able to see some pretty specific age breakdowns. So you can really examine the uninsured population for whichever age bracket it is that's of interest for you in your work, whether that's the elderly or young people under the age of 18 or the age of working people. So that's an example of some health data that you can really target and zoom in on exactly what age bracket it is that is of interest to you in your work. We also have a bit of data from the Center for Medicare and Medicaid Services here. So if you, under federal programs, it says Medicare, and you'll see that there's quite an extensive list of interesting data related to this population. So that could potentially be of interest to you as well, Andrea. And let me show you, since you had also asked about health clinics, that's a great opportunity for me to show you an example of what a point data set, how a point data set works on PolicyMap. You see under the Health tab and under all of our data tabs that there are two columns. The first two columns says data layers. So these are all going to be data sets that shade the map. So you'll be able to see them by block group or census tract, by county, etc. And then this third column says data points. And so these are all examples of data that are specific points, so they have an address associated with them. So this is the data that will really help you get a picture of kind of the health care infrastructure in an area. If you want to see where hospitals are in relation to federally qualified health centers, in relation to retail-based healthcare centers, in relation to nursing facilities, you can see all of that at one time, which really can help give you a picture of what the healthcare infrastructure is like in an area. So you see here it says hospitals. If we select that, now we're seeing all of these crosses on the map are the hospitals that are located in Providence. And so if I click on one of these, then you'll see that there's a bubble that provides all of the information that was available regarding that hospital. And so now I'm going to just add on the community health centers here, since you had asked about that. And now you'll see that all of the squares that are on the map are examples of community health centers and community health center lookalikes that are in Providence. So now you're seeing those as well as the hospitals on the map at the same time. And there's a lot of really neat things about this address level data, such as the health centers, the health clinics. If you click on one, you'll see that this is the Olneyville Health Center. You can see that there's a lot of information about that center, including the operating hours, whether it's a community health center, whether it's a healthcare for the homeless provider, which gets at Claudia's question from before. You can also see the kind of address information, and you see that every tab in here has additional information about the site. We also brought in some data from the Uniform Data Systems department of HRSA, and with that we were able to include a variety of quality of care indicators. So you can see, for example, the percent of women at the center who receive PAP tests, or you can see the percent of asthmatics treated with the appropriate pharmacological intervention. So there's a lot of really interesting quality of care data that's you can see that's associated with the health centers. And there's also, if you select any of the patient info tabs, you can get a really nuanced breakdown of what types of patients that center is serving. So the percent Hispanic or Latino patients, the percent African American patients, the percent children, so percent of the people who are under 18 years of age. So exploring these can provide you really interesting information about the health clinics. So it's an area that we do is pretty easy to and interesting to explore. The other point data within the health tab that I really would like to show you, because we have a lot of users that come to PolicyMap to access this data, is this section here, food and grocery retail access. Obviously food and grocery retail access is obviously very important when considering social determinants of health. And we have here is grocery retail locations, so this will show you where all the supermarkets are. This is relatively new. We just updated this with the 2013 data. You can also see where the farmers markets are, SNAP retail locations. And then we have this very interesting study that our Policy Solutions department did here at the Reinvestment Fund. Oops, excuse me. Just a second. Oh, let me, here. Okay, so this will show you where the areas are that are considered to be limited supermarket access areas. And so there was extensive research done to determine, considering a number of factors that ultimately determined where areas are that are considered to be limited supermarket access areas. And so any area on the map right now that is shaded in purple is an area that's considered to be a limited supermarket access area. So this is definitely an element, an area that is some data that is very commonly used on our platform. Okay, I'm just, give me one moment, I'm just reviewing. There's quite a few questions coming in, so I just want to review some of them. So there's one question but about how the platform compares to ArcGIS. And we definitely get that question a lot. So we are very online based. ArcGIS is kind of more software focused, so requires another level of expertise that PolicyMap does not require. At PolicyMap, we really focus on creating this online tool that's available to people 24 hours a day, where you don't need to have a strong expertise in mapping and GIS. So it's really made for people who work in a variety of roles, whether a policy, someone who works as a policy, a researcher, or, it really could be an epidemiologist. It could be anyone working in any type of field in any position without necessarily needing to have that really strong knowledge of how to use ArcGIS, whereas ArcGIS itself is really geared towards people who really specialize in that, if that makes sense. And if anyone has any follow-up questions related to that, please do type them in. But I would generally say that our product stands out in that it is really geared towards the policy person and, getting data out there in a way that is accessible and available and up to date and can be easily used by anyone in any role, and also can be easily shared amongst people so that you can really spend the bulk of your time analyzing the data and using it in a number of ways versus spending that time acquiring the data yourself and trying to figure out how to, get it into a platform. So there are a few other questions. One is from Bianca about whether we have data about, is there any injury medical-related data or mortality? So yes, here in the Health tab, you'll see we do have a section related to mortality. It's broken up into a section with related to deaths from disease versus injury deaths via homicide, suicide, motor vehicle traffic, and accidental injury. So you'll see here homicide, and again, this is from the CDC, and so it's available at the county level. So now I'm just going to remove the data here, excuse me, that's on the map. And I want to show you some of the pretty neat features beyond the data. And so I'm going to once again add these community health centers to the map. And I want to show you this function down here below the map, where this is where you can create a custom region. And so this is a feature that is very powerful, and this is what will enable you to be able to get access data for a certain area, such as a community health needs assessment area, and be able to create reports that will provide you data that you can use in your CHNA report for a specific area. So I'll show you here. It says create. There are 3 options for creating a custom region. One is to draw it, which I will do. You can also assemble it. If your target area is, a selection of 3 counties, you can create an area that is just that grouping of counties. You can also create a radius region. So if you want to see an area, a mile around the hospital where you work, you can create that area and then generate reports that will aggregate data specifically for that 1 mile radius around your hospital. But for right now, I'll create a drawn custom region. So let's say that this health center right here is where you work, and and then your community health needs assessment area is around it. So I'm just going to draw this area by connecting these dots. And then we'll just go ahead and call it CHNA area. And then I can save it, and now this region is saved here. There's a section called My Custom Regions, and you'll see that it is available right here. You can also share this region with other users by hovering over the share icon. But if I click here now on this point, then you'll see I can shade it in different ways. But it also allows me a number of different options. There's a lot that I can do now with the area that I just created. So we'll go ahead and just create a report that will show us give us an overview of the neighborhood and the demographic makeup of that CHNA area that we just created. So I'm going to select Get Report, and then I'm taken to this report page. I'm going to go ahead and create a report for a community profile report. You see that there are a few different options, but for your purposes, the community profile would likely be the one that you would most frequently use, because that gives you an overview of the neighborhood. Then I will preview report area and generate report, and you'll see now some of the data that's available in this report. But these reports are really powerful. They're a place that a lot of our users come to pull data really quickly for an area. So once you save your CHNA area as a custom region in PolicyMap, you can always really quickly come back to it and just very quickly get up-to-date data for that area. So whether it's for a grant that you're writing or some proposal, or you need it for a presentation, you can just really quickly come and generate this report. And I'll just scroll through really quickly so you can see some of the data that's available in the report. But you'll see it gives you a pretty nice overview of the neighborhood. So there's population trends from 2000 to 2010, 2012. You get a quick breakdown of the racial and ethnic makeup of the area. And again, this is over time, so you can very quickly see trends. You get to see a very easy, see what the age distribution is in the area, as well as the income makeup. And throughout the reports, we try to provide a comparison to a larger area. So you'll see that first here, you're seeing the income makeup for the CHNA area that we just created. But then you're also seeing the comparison to the county as well as the state. So again, it makes it very quick and easy to make comparisons for the area that you're really focused on, as well as the larger areas that it sits within. So again, there's data related to immigration, the family and household makeup of the area, housing type. You get a really quick picture of what the housing stock is like. Tenure, what % of people are homeowners versus renters. Vacancy, residential vacancy, as well as employment. Again, this provides a comparison to with the county and the state, and gives you a breakdown by industry. You can quickly see kind of what % of the people in that area are working in, say, healthcare and social assistance. So in this area we just selected, there's 15% of the population is working in that area. Then we have the crime data that we talked about earlier, and that's it. So these reports are, one of the easiest places to go just to pull really, really quick data and get a really quick overview of a certain area. So now I'll go back to the maps page. I also want to show you down here, it says map boundaries, and this is where you can overlay some boundaries on top of the map. And there are a few that we've added that are very specific to the health field that we have a number of users that are using quite frequently. And so you can see you can add the basic boundaries if you want to add the state boundaries to your map, or the census tract or block group boundaries, you can. But you can also add, if you want, hospital referral regions, the hospital service areas, and primary care service areas on top of the map as well. So that can help provide some context to whatever it is that you're already looking at. And at any point when you're working with PolicyMap, if you find a map that you really need to save, you can save it. You see there's a number of icons up here above the map. There is an email icon. You can quickly and easily email any maps to somebody else. You can quickly print a map by clicking here on the print icon. You can save the map, so if you want to come back to it at another, tomorrow or next week or next quarter, you can do that. And then we also have an embed feature so that you can quickly embed a map onto your website if you like. So I have a question here from Catherine Keitzman. Sorry if I pronounced your name incorrectly. It says, is there a way to add more information to the map, e.g. location of social service organizations, pharmacies, etc.? So yes, that's a wonderful question. You can add, with these address level, the point level data sets, you can add as many of them onto the map as you would like, or really as many as your eyes visually can handle. It can be hard for people to take in more than a certain amount of information, but you are not limited in the number of points that you can add on top of the map. And in terms of social service organizations, one really commonly used data set that we have is here under quality of life. It's this nonprofit locations. And so this can help get at not all social service organizations, but any ones that are nonprofits. And so right now you see any of the orange squares that are on the map are all different nonprofit locations. And this filtering right here, it says filter points. This provides you the ability to see just a subset of the data. And so you see if this provides you the ability right with the nonprofit locations data set to only see the nonprofit locations in a certain sector. So if we want to see just the nonprofit locations in the health sector, we can select health, and now all the squares we're seeing are going to be social service organizations that are nonprofits that are in the city of Providence. And you asked about pharmacies. We do have this retail-based healthcare here. We don't have a data set that's pharmacies specifically, but you see I can add the retail-based healthcare onto the map. There doesn't seem to be too many in the area that we're looking at, because these are going to be showing up as the blue diamonds. But yes, you can keep adding as many point data sets on the map as you'd like. So if I want to add SNAP retail locations, you can add those. And now you see that they're all different icons, so it makes it easy to see the difference between them. And really quickly, I want to get to show you another feature, which is here, the data. It's called the data loader. And this is something that we're very excited about, and it gets a ton of use by all of our users. And this is where you can upload data yourself. So if you have a spreadsheet of any address level data, so say you have a spreadsheet that has all the addresses for all of your patients, and you want to see where your patients are coming from to get to your health center, or if they're the patients that your hospital is serving, you can very easily upload that spreadsheet of a patient address data, and then you'll be able to load that onto the map. And then after you create the data set, once you go back to the maps page, then you'd be able to layer that data that you just loaded on top of all the other data we have on PolicyMap. So it really is extremely powerful. We also have a lot of our users who work in health load things like the WIC locations, women, infants, and children locations, for their local area. They'll load them onto the map using the data loader. And then you can, what's really powerful is you're able to see that on top of all of the other data that we already have in our platform. So I have another question coming in about whether any data I upload will remain private or whether it will be shared with anyone. And that's a really excellent question. We have a number of different options. By default, we would assume that your data will be public to you, but there is an option when you're uploading your data using the data loader. It will ask you, you'll be asked whether you want the data that you're loading to be private to you, whether there's any other individuals, say in your organization, in your company, that you want to share the data with, excuse me, or whether you want to make it publicly available. So you don't need to worry if you're uploading, obviously with uploading patient data, there's a lot of sensitive data that you clearly would not want any to be made available publicly, and so you don't need to worry about that. It will only be made available publicly if you specifically and very explicitly ask for it to be. So we have quite a few users that upload, patient data and data that is very sensitive, but just for their own use internally. So I would love to get any other questions. We have 15 minutes left, so I just want to put a call out there for any additional questions that you have. There's plenty more that I could show you, but I want to make sure to cover the things that are most important to you. There's a question coming in about whether it's possible using PolicyMap to identify areas that meet certain criteria. So there is, and it's right here next to Data Loader. There you can select 3-layer maps, and this is the part of our tool that will let you identify areas only the areas that meet the specific criteria that you're interested in. So I'm just going to remove some of the data that we have on the map currently. So you can use up to 3 different data indicators when you're doing this. So if we're looking for an area that is considered to be a medically underserved area, if we go to health, you see under federal programs, we can select the data layer that shows us any areas that are considered to be medically underserved. And so right now, all the areas in purple are areas that are considered to be medically underserved areas, and this is from HRSA as of 2014. And so say we also want to know, we want to see areas that are medically underserved, but also where the Spanish-speaking population is at a certain threshold. So if we go to demographics, down to language, Spanish-speaking, and add that, we can now adjust the ranges for this data layer. So say we want to only see areas where at least 15% of the population is speaking Spanish at home. So now you see that the purple areas on the map got much smaller once we added that other data indicator. Just a moment. There you go. So right now all the areas on the map in purple are areas that are both considered to be medically underserved and where at least 15% of the population or more is Spanish speaking. And then you can also add another layer if you would like. Say you want to see areas also where at least a certain percent of the population is receiving food stamps. So I can add that third layer and then adjust the thresholds as I want. Say I want at least 15% of the population to be receiving food stamps as well. And then now the map will update, and again, any areas shown in purple are areas that meet the criteria, all of the criteria that you set forth. So this can be really excellent, and whether it's site selection, you want to identify a certain area where you might locate another health center, or where you want to have some community-based outreach, because it meets certain criteria, this makes it really easy to do that. So I have a question coming in from Mike Craycraft that's asking, are we able to designate or segment address level points? For example, on the health nonprofits in an area, can we designate if they are not a partner of ours? So with any of the data on our tool any data that's already loaded, you're not able to edit it yourself. If you load a data set yourself, you can always edit that, and if you're the one who created it, you can go back and edit it at any point. But you would not be able to just add another field of data to a data set that we already have on PolicyMap. But if you're a subscriber with us, we could always probably figure out how to create a new data set for you that has a separate field that's showing whether or not a health center is a partner of yours or not. I mean, we can work with you to load lots of additional local data that's very specific to what you need, but we can't just go ahead and edit any of the national data sets that we currently have on our platform. Just give me a moment. I'm just reviewing to see if there's any questions that I missed here. I also want to go ahead and show you this one other tab that has a wealth of data in it that can be very relevant to hospitals and various health entities that are also interested in community development. I won't spend a lot of time here, but just want to make sure that you are all aware that this exists, because we do have a real specialty here at PolicyMap with loading data related to eligibility. So if you want for various federal programs, so just so you know, if you are interested in knowing where areas that are eligible for Community Reinvestment Act investments, or Community Development Block Grant investments, or a New Market Tax Credit projects, you can come to PolicyMap and look under federal guidelines, and this can be extremely helpful in quickly identifying areas that meet certain criteria meet certain guidelines, so that you're able to bring in more of this federal money into the area that you're focused on. So I have a follow-up question coming in regarding Mike Craycraft's question, which is asking if, with the example of the health clinics, whether you're able to upload or download the data. Oh, it's asking so with the health clinics whether you could possibly download the data, edit it, and then upload it yourself as a new data set. And yes, as long as it's not one of, it depends on the data set. We do make the downloading ability available for all data sets that are not proprietary, so that we don't, there are a few that we're not able to make available for download. But yes, you are able to download the majority of the data in our tool. And so at that point, you could definitely easily have the data in Excel, add a new field that would, could be whether or not that health center is a partner of yours. And then you could use save that and then use our data loader to upload the data as a new data set. So that's actually, thanks, that's a very good point. We have a question from Claudia asking if developing a presentation, if it's possible to video map transitions. And no, we are not able to. You can, if you're creating a presentation, you can export a JPEG or PNG file that you can easily put into your presentation, but not necessarily a video at this point. So I'll just put a last call out there. If there's any additional questions that you'd like to send in, please do it right now, and then I'll just stay on the line here for a few more minutes and see if any other questions come in. So again, I just want to reiterate, if anyone would like additional training, we do have trainings that happen several times a week. You can go to PolicyMap.com and sign up for them on the dates that you're interested in. But I think at this point we'll go ahead and wrap this up. Thank you so much for joining us. It's been a pleasure, and please do email us or call us with any follow-up questions. Thanks a lot, and have a great afternoon.